If a family member is diagnosed with hypertrophic cardiomyopathy that you know, one of the best places to start is to get a consultation with a HCM cardiologist within an HCM center of excellence, for which there are now over 50 or more coast to coast in the United States. Hello, I'm Marty Maron. I am the director for the Hypertrophic Cardiomyopathy Center at Lahey Clinic. I think one of the important pieces of advice that I can give, and certainly born out of a lot of experience, is that in patients that have a diagnosis, so if you have a family member who's just had an HCM diagnosis, then having that patient, family member who is a patient now, evaluated in an HCM center of excellence is a really important piece of advice. And so what I mean by that is that, over the last couple of decades, essentially, there's been the development and really growth of expertise among cardiologists who treat HCM within hospitals, usually, that get designated as sort of HCM centers of excellence. So this is where a concentration of expertise for the disease is. And I think by seeking care at one of the HCM centers is really advisable because of obviously the level of expertise that can be given to patients in those places, but also the level of treatment is usually obviously very high as well. Delivered those treatments with high level of expertise and follow-up. And so I really am a big proponent of the advice that patients that get diagnosed should be seen and maybe even ultimately followed longitudinally over time by cardiology team in an HCM center of excellence. And typically for most patients who are then stable, meaning feeling well on therapy, it's at least a visit annually to their provider to undergo usually some form of repeat testing. Usually that's an echocardiogram and an ambulatory monitor, and to be seen again to make sure that there are no adjustments or different recommendations that may need to be considered, at least on an annual basis at that point. And that's generally, obviously there's exceptions to that. Some patients may need to be seen sooner than that as well, depending on what may be going on. But certainly for the vast majority, it's at least a yearly evaluation with testing.